So, good afternoon, everyone. My name is Rita Oliveira, and I'll moderate this session of Media Innovation Circle. And our guest is Débora C. Hi, Deborah. Thank you very much for accepting our invitation. It's a pleasure to have you here. Sharing your work and knowledge. Deborah, thank you once again for your time. Currently, Deborah is a full professor in the Department of Computer Science, Fluminense Federal University in Brazil, and her main research interests include multimedia systems, computer networks, smart grids, IoT, and digital healthcare. She is one of the founders and heads of the MídiaCom Research Lab, and she is also the PI of the eHealth Rio Project, supported by the Rio de Janeiro State Research Support Foundation. Deborah will present this project and explain its goals in her talk. Well, Deborah, you can start your talk when you want, and once again, thank you.
Thank you very much, Rita, and our colleagues from the University of Aveiro for this, kind invitation. It's really a pleasure and an honor for me to be here, sharing my work with you. And I, of course, hope to meet you all very soon at IMX, that is going to be held in June in the University of Aveiro. So thank you again. It's a pleasure to be here and to talk to you. I'm going to share my slides here, okay? Just a minute. Can you see it?
It's okay.
All right. So yeah, as Rita told you, I am a professor at the Institute of Computing at Fluminense Federal University, or UF, as we call it in Brazil. So I'm going to talk about one of the projects, the research and development projects that we are currently doing and working on, which is called eHealth Rio Project. So just before, starting my talk, I would like to, inform you where our university is located. So it is located in the state of Rio de Janeiro in Brazil, in a city called Niterói. So our campus is just in front of the Guanabara Bay. So we have this very nice view of Rio de Janeiro, where we can see the Sugarloaf and Christ the Redeemer from our university offices. So it's a really nice place. And of course, I invite you all, if we have the opportunity, to go there and visit us. So at our university, I have founded with other colleagues the MídiaCom Research Lab, which is a partnership between the Institute of Computing and the School of Engineering at UF. And our main research interests are multimedia and digital TV, computer networks, and digital healthcare. So our group started small. We were 4 professors when we founded the lab, and our team has 15 professors and several graduate, undergraduate, and postdoc students working with us. So this photo was the last one taken before the pandemic. We are still returning now physically to the university. I mean, we spent the last 2 years working remotely. So this photo was taken in the end of 2019 when we did our annual workshop, sharing, our researches and work that we do at our lab. So our lab has several supporters as Brazilian funding agencies, such as CNPq, as FCT that you have in Portugal. We also have state agencies as FAPERJ, which is one of the supporters of the eHealth Rio project that we're going to talk about, and other different agencies that support research and development in Brazil too. And we also have been developing some projects together with industrial and also government partners, especially in the electric sector, about smart grids, as Rita told you that we also work on, and the SBTVD forum, which is the forum for the Brazilian digital TV system. So we also have working with them very closely. So one of the projects that we are developing since 2020 is called eHealth Rio. So in fact, it is a research and innovation network aiming at digital healthcare applied to chronic diseases. So we are researching and applying our research on computer science to help the diagnosis and treatment of mental disorders, neurodegenerative diseases, cancer, breast cancer, and thyroid cancer, and also cardiovascular diseases. So this project is funded by FAPERJ, which is our state research support agency. And we also have the partnership from other universities in the state of Rio de Janeiro. So we have the University of the State of Rio de Janeiro, UERJ, the Federal University of Rio de Janeiro, UFRJ, sorry, and the Scientific Computing National Lab, which is called LNCC. We also have some international partners from the UK. University College London and Brunel University are also working with us. So the main project goals, in fact, it's a bigger project. We have a big group of researchers from different universities. So I'm going to focus more on the research project goals that we are working on at the MídiaCom Lab here in the Stock. So we are working on new solutions for neuroimaging analysis using AI techniques, new solution for medical image and physiological signal processing for helping diagnosis of mental disorders such as PTSD, neurodegenerative disorders such as elderly diseases, breast cancer, and thyroid tumors. We are also working on clinical decision support systems and also on patient remote monitoring using wireless body-area networks and Wi-Fi networks. So in fact, we try to apply our computer science expertise on multimedia and computer networks to the digital healthcare field. And we are also working on solutions for multisensory systems applied to healthcare therapies. So this last topic is the one that I'm going to talk a little bit more in this talk. But anyway, I'm going to give a very fast overview of the other topics that we are working on too. So together with the Biomedical Institute researchers at UFI and some colleagues at UCL, University College London, we have been working on using machine learning techniques for analyzing physiological signals such as heart rate and skin conductance that were collected in a controlled experiment did by the biomedical research partners, and where users, they had some kind of, some of them are, a control group, and some of them have PTSD, post-traumatic stress disorder related to violence. So they did this study where the users had to watch a sequence of violent and non-violent images, such as the ones shown here in the slide. And they collected heart rate and skin conductance during the experiment. So we have, analyzed those data in order to predict what they call the PCL scale, which is a well-known scale used in the psychiatric and the psychological area to diagnose and to indicate PTSD symptoms. So the idea of this research is to propose, probably in the future, a kind of biomarker that could help physicians diagnose better, as another tool for them to help diagnosing of PTSD. Talking about breast cancer, we have this research together with some other colleagues at the Institute of Computing. So we have Professor Aura Conci, which is who is a very close colleague, and she's has been carrying this, doing this research for several years. So I have collaborated with her in some parts of it, like co-supervising PhD students. So the idea of the work that I have participated in is to analyze what we call dynamic infrared thermography images of the breast. So those images, in fact, they capture the temperature information of the skin. And in the dynamic capture, in fact, we have several images of the same patient. So the patient, before the exam is done, we have a cooling process for her to diminish the temperature of her body, and like for 5 minutes, and we stop the cooling process and then start capturing the thermography images during some time. So the idea is that regions where tumors and more specifically malignant tumors, they require, they recover the temperature faster than normal regions. So what we did is to analyze the temperature variation over time, considering those temperature information in those images. So we have used artificial intelligence and machine learning techniques to analyze temperature time series in order to identify if the patient has some kind of breast anomaly, which can be a tumor, benign or malignant, and if it can be diagnosed with cancer also, because we have different groups of patients. We have this research was done together with the university hospital. So patients that were actually being treated by physicians at our university participated in this study. And more recently, we are trying to apply those techniques to follow up what they call neoadjuvant treatment. So some patients, they have a kind of severe cancer. So before going into surgery, they receive this kind of treatment in order to make the tumor smaller. So the idea is to use this kind of thermography to follow up and see if the tumor has really, become smaller or not, if the treatment had a good result or not. So we are, in fact, co-supervising a PhD student that is working on that. And we also have the collaboration of University Rey Juan Carlos in Madrid. So we have a partner who is also working with us, which is Professor Ángel Sánchez from Madrid. Another topic that we have been working on is about helping the diagnosis of dementia, Alzheimer, and mild cognitive impairment, which is usually a pre-stage of dementia that will probably become dementia and then Alzheimer's. So the idea is to anticipate the diagnosis and start the patient treatment in order to increase his quality of life, and trying to avoid that this MCI becomes really dementia and then Alzheimer. So we have this particular characteristics of patients in public hospitals in Brazil, because usually elderly patients in public hospitals, they don't have neuroimaging exams. And so most available data is patient, demographic data and what they call neuropsychological tests, which are, very simple tests and cheap tests that can be done with a psychiatrist in his office. So what we did is to consider this data that was that were available in Brazilian healthcare units, and develop a dynamic decision model that considered this data and indicates the probability that the patient has, MCI or dementia or Alzheimer. And another interesting characteristic of this work is that the decision model is dynamic in the way that it can adapt to new patient information, new patient attributes, or new psychological tests that start to be done in that health unit, and also new patient cases. So the idea is that the system, it's like dynamic, and it continuously learns with new patient cases and new patient attributes. So this work is also done, of course, together with several physicians, geriatric and psychiatrists, and it's a partner with the Federal University of Rio de Janeiro and also with the University Hospital at UF, at our university too. Talking about computer networks, we have also been working with wireless body area networks, which are called WBANs. So those networks, they are composed of sensors or actuators that can be wearable devices, but they can be implanted devices in the body. So we have studied and proposed new routing protocols for those kind of networks, for WBANs, that consider the link quality and also the node temperature information in order to calculate new routes. And we aim at saving node battery, because when you have an implanted device, you don't want to keep changing the device very frequently, as the battery is gone. So we need to save battery. And we also need to prevent node heating, because node heating could cause what they call tissue heating that could really harm the person that is using an implanted device. So, in fact, in this case, our work has been done with simulation techniques and simulator, because it's very hard to find real devices that implement WBAN standards. So up to now, it's still like a theoretical work with simulators. And also in the area of computer networks, more recently, we have been working with traditional Wi-Fi networks in order to try to detect vital signs such as heart rate and breathing. So this research could be applied very nicely to monitor COVID-19 patients, for example, in isolation, because they don't need to wear anything. So in this case, we use off-the-shelf wireless access points and wireless devices to transmit and receive Wi-Fi information, and to capture what we call CSI data, which is channel state information data. So analyzing this kind of data with signal processing techniques, we are able to detect those vital signs, and also maybe human activities, such as if the person is sit down or is laid down, or if the person fall down. So it can be useful for different kind of applications. So this project is we have begun it more recently. So now we are asking for the Research Ethics Committee approval to collect CSI data for like 300 people in order to build a CSI database and make it available, of course, for the research community in order to incentivize research in this topic. So now going to the specific topic of this talk, we are also very interested in proposing new healthcare therapies that uses multimedia and interactive media and multisensory applications in order to provide cognitive stimulation for patients. So in this area, in fact, we have two different kinds of patients. We are interested in elderly patients, as we already have this previous research and partnership with the geriatric team at our university hospitals. But we are also interested in ASD children, in autistic children that could, of course, benefit from this kind of cognitive stimulation too. So our idea is to integrate multimedia and sensory effects in order to stimulate, different parts of the brain and different senses that we have. And so we also intend to propose this kind of multisensory therapy rooms that could be used by therapists, for example, in a physical installation. So we can have different types of content provided to the patient in order to stimulate, for example, memories following a certain kind of content or a special sense, considering that we can use not only sight and hearing that are already stimulated by traditional audio-visual multimedia data, but the idea is to use sensory effects to simulate touch, smell, and even taste if we have technology for that available. So those kind of applications, we are using this term, which was introduced by Professor Ginga at Brunel University, which is called multimedia, is the idea of integrated multiple sensorial media in the same application. So we have identified a kind of gap in multimedia models in order to represent sensory effects. If we analyze the literature, we have several proposals of multimedia conceptual models. And when they talk about sensory effects, they usually do like low-level programming in order to start physical actuators and really render those effects in practice. So our idea is to represent a sensory effect the same way that we represent a media object in traditional multimedia. So if we analyze like multimedia models, the most common entities that they have are multimedia nodes and links, and some of them provide compositions. So our idea is to specify a node, not only in a media node that could be like audio, image, video, etc., but also a sensory effects node that could represent a wind sensory effect or a sound sensory effect or a light sensory effect in a higher abstract level. So this would facilitate the creation of those kind of applications for different kind of authors. So that's what one of the main focus of our work. So we have proposed a new conceptual model, which is called Multisim, Multimedia Sensory Effects Model. And this Multisim model, it represents sensory effects as nodes. So we can create relationships between sensory effects or between sensory effects and media nodes the same way that we are accustomed to do with traditional media nodes. So this ends up making authoring easier than using low-level programming in order to render sensory effects. So the low level is left to the presentation engine that is going to play and effectively execute the whole application. But during authoring time, the author doesn't have to worry about those low-level detail. So using this Multisim model that we have proposed, we developed an authoring tool, which is called Steve. So Steve looks like a commercial video editor. The idea was to use the same kind of interface, but here we can have traditional media nodes. We can have different type of sensory effects. We have this kind of timeline where we can drag and drop media nodes and sensory effects to synchronize them. But although it looks like a timeline, we can create event-based relationships between sensory effects and media nodes. So it's much more flexible than just using temporal information in order to synchronize it. And well, continue on the authoring effort that is necessary to create those kind of multisensory applications. If we think about, specifying sensory effect, someone has to, of course, inspect all the whole for example, video content in order to identify that during the scene we have a grape that is presented, so we would like to create and synchronize a grape smell effect during that period of the video. So if this video is very long, and for example, in a movie where you can have several explosions and the author would like to create different heat effects or vibration effects, the authoring effort, of course, will be bigger too. So our idea is to provide what we are calling a kind of semi-automatic multimedia authoring, with the idea of using intelligent tools that are developed using deep learning techniques, using neural network to analyze the audiovisual content. So those kind of networks, they usually return a set of labels that indicate concepts or objects that are present in the video frames, in those scenes. And we have a dictionary of sensory effects types that relate some set, a particular set of labels to a particular type of effect. So for example, in this video where we have the sun being presented in those 3 periods, we can have a yellow light sensory effect automatically created and synchronized with the video content. And here, for example, we have a forest appearing in those 3 seconds, first 3 seconds. We can have a tree aroma sensory effect, a scent effect, automatically specified. Of course, we believe that this kind of creation, it depends on the author preferences too. So our idea is to provide what we call a semi-automatic authoring. So the author can extract those sensory effects automatically, and then he can change the durations or delete or like edit the way he would like to for the final user. So we have implemented this idea in that tool called Steve. So I have a short video. I think I'm going to show you here. So I'll stop this presentation to show the video. Let me see where it is. It's here, okay. So can you see now the YouTube? Okay, so very shortly, so this is Steve, so we can drag traditional media, for example, video to the timeline, and then we select auto extract sensory effects, and we select different types of effects that should be extracted automatically using that neural network. In this case, we use Google Clarify API that already provides the labels associated to the media, and then we create sensory effects in the timeline. So you see in the beginning we can have like a light effect, for example, and then a temperature, a hot temperature effect, and when the scene changes for the snow, we can have a wind temperature, cold temperature effect, and here where we have flowers, we can have a scent effect, and those are automatically extracted from the video. So the idea is to do this automatic extraction, and then the author can, of course, remove some of them, because probably it will be not so comfort if we have different and so many sensory effects being rendered at the same time. So, of course, we need the author adaptation and final edition to provide a good application for the user. So I'm going to be back again to the presentation, to the slides, to continue here. Okay, so our idea is to create those kind of physical multisensory therapy rooms that could be used with elderly patients. But another idea is to create virtual therapy rooms where we can use for example, virtual reality and head-mounted displays. And some of them are currently integrated with rendering effect devices, such as a smell device that is integrated to this HMD here, or this Feel Real mask that we can adapt this lower part, and we can have different kind of sensory effects. So another idea is to use virtual reality content to help this cognitive stimulation for patients. So we have done some experiments following this topic. So we have developed at first a card memory game for elderly. So it was developed using Unit. And we have used that lip motion device, so they are able to interact with their hands. So the idea is a card game to find both cards that are the same, just like a memory card game that we play in a table, for example. And we have done some experiments with an elderly group that participates frequently in some activities there in our university. So this was done just before the pandemic. So this project is a little, of course, it had to be stopped during the pandemic because we didn't have any physical activities at the university, and now we are returning, so maybe we are going to continue with tests with this group. And well, following on in the same topic, now we are working on a different authoring tool in order to create 360 multimedia experiences in the VR environment. So this new authoring tool, it is completely immersive. So this is an author using the authoring tool. So he is able like to include 360 video or 360 media, and to include different kinds of 2D media, such as images or text. And they can make those media interactive, so they can create different scenes, and the final user could navigate between scenes, pressing the VR, button controls. And they can also include sensory effects. So we will have, when rendering this application to the final user, virtual sensory effects in the virtual environment, but also physical sensory effects using physical actuators that could be, placed around the user physical space where he will be when he's using the application that was created by another author, for example. So in our prototype, we already have heat sensory effect, wind sensory effect, and aroma sensory effect already working in this tool, which is called a Muse VR. So we had a first publication in the previous IMX in 2021. In some slides, I'm citing the publications here if you, are interested in more information about it. And one last different healthcare therapies that we've been working on is aiming at ASD children with autistic disorders. So in this case, we are using socially assisted robots, SARS, and well, those kind of interactive robots that can provide stimuli using interaction with the robot, and they are very well accepted by children. So they can be used as different types of healthcare therapies, of course, as non-pharmacological intervention if the therapist agrees, of course, to include it in the treatment. So this project is a partnership with Mexican colleagues at an institution called CISESI in Mexico. So they have already created a socially assisted robot, which is called Eva. So the robot is shown here. And they have proposed and used Eva for therapies with elderly people, for patients with dementia and Alzheimer's disease, and they already have several published results and papers about it. So our intention is to extend EVA's functionality for therapies aiming at emotion regulation for autistic children. So the basic, original capabilities of EVA, they already include verbal communication using voice recognition, so the user speaks and the robot understands, and the robot also uses speech to communicate. So the interaction is basically using voice. And the robot also has non-verbal communication, so it can express emotions through its eyes. It can move the head, of course, to express emotions too, and it has a set of animated lights here in the chest that we can use with different colors to help expressing emotions too. So we already have extended EVA's capability with light sensor effects and also using a webcam to recognize facial expression of the user in order to, aid therapies for emotion regulation. And the light sensor effect is done with a smart bulb. And using those extensions, we have developed a serious game for emotion regulation for ASD children that is basically composed of 3 stages. So in the first stage, the child has to guess the correct color of the smart bulb that the robot controls. In the second stage, the child has to guess the emotion of the robot that is shown using his eyes expression and head movements. And in the third stage, the child has to imitate the robot. So the child will train how to express happiness or sadness or anger, which are the expressions that are currently supported by EVA. And we had done a first evaluation of the serious game with ASD therapists. So as we were working during the pandemic, we have not evaluated with ASD children yet. So we have, in fact, recorded videos of a neurotypical child playing the game. And we have used the technology acceptance model to structure the evaluation. So we have shown the videos to a group of 44 ASD therapists. So 20 of them were considered beginners and 24 were considered expert therapists if they had 2 or more years of experience in ASD therapy. And we have analyzed statistically those data, and well, both groups have agreed that the robot would be useful during therapies and that it would be also easy to use the robot in their therapies without too much effort. The experts, they indicated a possible difficulty in verbal communication with EVA, especially for children with more severe ASD, of course. And so this kind of therapy may not be indicated to all ASD children. Of course, the therapist would need to evaluate that. And just in one question, because after the therapists, they watched the videos, of course, they had to fill in the TAM questionnaire. And only in one question, we found a statistical difference between beginners and expert groups, because beginners found that sound effects would make sessions more appealing to children, but the experts said that you cannot use too many sound effects with autistic children because they can be uncomfortable with that. So now we are still continuing this research, and our idea is to facilitate the creation of multi-sensory interactive therapy sessions with the robot, especially with the idea that, sometime in the future, we would like the therapist to create his own session with the robot for his own patients. So we are working on 2 new proposals, an XML-based language, which we called EVA-ML, and a simulator for the robot scripts, which is called EvaSim. So idea is to debug and test the script before using the physical robot in practice. So this would, of course, facilitate the development of new serious games and therapy sessions with the robot. Well, besides all those work, we also have some other current researches. It's not the focus of this talk, but we are also working on digital TV interactivity functionalities for our digital TV system in Brazil. So now the SBTVD Forum is working on a project which is called 3D TV 3.0, which is specifying the future generation of our Brazilian TV system. And our institution, UFI, we have proposed some new functionalities for enhancing the application coding layer of the new system with immersive TV capabilities, including sensory effects and also multimodal user interaction inside Ginga-NCL, which is the current standard used in Brazil. And well, talking about multimedia, we also have some different research about Internet of Media things. So we are working on what we call virtual multimedia sensors. So our idea is to reuse, for example, cameras and microphones for different kind of multimedia applications and facilitate the development of those applications using an edge infrastructure, cloud and edge infrastructure. Well, to finish my talk, I would like to remind you, of course, at the University of Aveiro, you are our colleagues in organizing ACM IMX this year, so it will be a pleasure to have you all in Aveiro. Of course, I will go and be physically there too. During June 22 to 24, we have several open call for contributions, and it's been a great pleasure to work with our friends, Jorge de Abreu, Pedro Almeida, and also Jesus Gutierrez from Spain in organizing this conference. Just a week before IMX, we have another multimedia conference, which is very important too. It's the ACM Multimedia Systems conference that is going to be held in Athlone in Ireland. So I'm also in the organizing committee, so it will be a pleasure if you can contribute with your work too. So thank you very much. This is the end of my talk. It's really been a pleasure, and I'm open to questions, and it will be a pleasure to talk with you.
Okay, Deborah.
Nice.
Okay, thank you very much, Deborah. It was a very interesting talk. So it's time for some questions, remarks, or comments from the audience. Does anyone want to start?
Should I?
Okay.
Hi, Deborah. It's very good to see your talk, because I'm working now in a PhD thesis with this kind of team. I'm doing my PhD in Aveiro and Porto. I live in Aveiro now, but I'm not in Aveiro right now. But I'd like to know some of this robot. It's a free robot that I can use in my research. How can we do the same things? Because I'm starting to study about elderly using ECAs, embodied conversational agents, to treatments in chronic health diseases. Sorry. So I'd like to know about it.
Okay, very nice question, Julio. Thank you very much. Yes, in fact, all the robot code, it's open source. So our Mexican colleagues, they have made available all the code and also the 3D models. So you can print the robot parts and assemble the parts to build the robot. And as we are, collaborating with them, we are also going to make all the extensions that we are working on available for the community. In fact, it would be very nice if at least you could help us to test and evaluate. We are going to start an evaluation about this XML language and the robot simulator. So maybe this is a nice opportunity for you to get in touch with this kind of robot technology, and then you can build your own physical robots and test it in the physical environment.
Very good, very good. Eu estou arrepiado. I can't translate it, but eu estou arrepiado. Secondly, how can you put the emotion in the talk of the robot? How do you use to make some prosody or something like that to interact with the elderly or the children, whatever, with some socially aspects?
Yeah, this is a very interesting idea. In fact, we are not putting the emotion in the robot's voice yet. So the robot can express emotions using the eyes. So we have like an eye expression for sadness or for happiness. And he can also move his head. For example, when he's very happy, ha, 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 the head goes to the back, or when he's very sad, he can, move the head down. So, yeah, so we are not using like voice modifications to express emotions, but this would be a very nice topic to do research and very complementary to what is being done.
Let's do it.
Other topics in the robot.
Let's do it. And finally, should we use the robot to make some Magic of Oz, or whatever, to simulate the use of the robot, but under this, a person interact with the user?
Yes, in fact, the robot has a mode which they call Wizard of Oz. So I don't know if I understood your question, but in this case, you can have a human being controlling what the robot does with the children. So the children would interact with the robot, but for example, we can have a therapist or someone else in the other room giving commands in real time to the robot. So this is possible too. In fact, the Mexicans have it already implemented. They used to do that when they did the evaluation with the elderly people. So they have some publications about it. If you can email me, I can send you. But it's possible. Yeah, it already has this functionality.
Okay, thanks a lot. Congratulations.
Thank you. Pleasure talking to you. And
me too.
Good luck to you. And maybe we can collaborate. That would be very nice.
For sure, for sure. We'll collaborate, for sure.
Okay.
Bye-bye.
Nice to meet you.
Nice to meet you.
Okay. Does anyone want to pose another question? No. I have one. Okay. So regarding the multisensory room, which pathologies are it designed for? It is to activate which cognitive activities? It is more aimed at the elderly, since Deborah said that the VR glasses were tested with games for the elderly. It is more directed at this audience, both the multi-sensory room and the VR devices.
Yes, in fact, our idea is to build this multisensory room in the healthcare unity at our university hospital that treats elderly patients. So there they are very much specialized in patients with MCI, mild cognitive impairment. So their idea is to use this kind of stimulation to preventing MCI to evolve to dementia and later to Alzheimer's. But in fact, we are still like developing the technology, and because of the pandemic, we have not installed a physical room in the hospital yet. So I intend to do it during this year. I hope so. I get it done. And then we'll probably have specific applications, of course, developed together with physicians, geriatrics, and psychologists that are experts in MCI and treating elderly people. But I think that the main idea is to stimulate their memories. So we'll probably have some kind of application that reminds them of someone they did in the past or something like this to simulate their memory.
Okay, thank you. Very interesting. Regarding the EVA, it communicates with children with speech through pre-recorded phrases, or use some kind of artificial intelligence engine or
yeah, well, nice question too. Well, now in its current version, so we have to program to specify, which sentences Eva is going to talk. Okay, but it can ask a question, for example, to the child, and then Eva will use a kind of voice recognition to understand what the child is talking about. But usually it is a question that waits for some kind of specific answer. For example, when in that game, that serious game about emotions, the robot would show an emotion and ask the child, which emotion did I show you? So the child can answer, oh, you showed me that you were happy, for example. So we are waiting for the happy answer. And so the child can speak anything, but as long as the happy or happiness word is included in the sentence, the robot can understand the correct answer. So in fact, for the speech to text and text to speech, Eva uses the IBM Watson services. So, it is able to use different kind of languages. So the robot was initially developed using Spanish and English, and now it talks, Portuguese. So we have very much flexibility about the language to be used. But it would be very nice to have like a future version of the robot where, the robot can freely interact, for example, as a voice assistant that we have, commercially available today. So this would be interesting too. And maybe this way the robot could be given to the child for them to take it, at home and to interact freely during their, spare time. So it's a little bit different from doing a therapy, which is accompanied by a therapist. So it's a much more controlled environment.
Yeah.
So so in this case, the therapist would like, to control a little bit more what the robot speaks and which are the answers that are expected.
Okay, thank you. Professor Oscar?
Let me just put my microphone on. Hello, good afternoon to all. And thank you, Deborah, for your time and for your talk, to be here with us. Actually, you have here an immense research when you joined. It's related with what Rita was just discussing with you. You have here an immense research that relates artificial intelligence, neural networks, and human behavior, namely emotions and so on. We have also started doing some things in that area here in Aveiro also, namely the conversational systems supported by artificial intelligence. And what I'm curious, if it's possible for you to share with us in a short time, is how do you get your data sets for your artificial intelligence engines, or how do you train them, the data sets, to really get a good interaction in terms of behavior?
Well, in terms of voice interaction, in fact, we are using the IBM Watson service. So they have used their data sets and they just made available this API that we have used. But we also have this kind of facial expression recognition. So in this case, we have used an available data set of images expressing different kinds of emotion in order to train the neural network to recognize the child's facial expression. So yeah, I can give you more details about it if you'd like to. Yeah, but our facial expression recognition model, it can understand or recognize more expressions than the robot can express today, because you only have 4 expressions in the robot, which are neutral, angry, sad, and happy. And with the facial expression model, we also have the afraid expression, the disgust expression. So we have some other different expressions. They are not being used currently with the robot because we still have to design the robot expression for him to express these other feelings too.
Thank you, Deborah. With the conversational system, the one you're using with the children, you're not doing any data setup, I suppose. You're just using what Watson is giving to you. Okay.
Yes. Yes.
Okay. Thank you. Thank you.
Yes.
And thank you for your time here with us.
You're welcome. You're very welcome, Oscar. Thank you. Thank you for your question.
Okay. I will finish the session. Thank you, Deborah. It was a juicy session, and as we have various groups on DigiMedia that focus on issues raised by your talk, we always appreciate to know new ideas and projects in this area, digital media. So it was very interesting to hear you, and thank you once again. Thank you very much.
Well, I thank you. It was really a pleasure, sharing our work and getting your feedback. And I hope to meet you soon in Aveiro. So
yes.